Previously, we had said we were only going to do media briefings via teleconference so that we would not have aggregate groups of folks coming together. However, we wanted to really represent social distancing to individuals. We felt it was very important to meet today, this one time in person, to assure that every resident understands that we are united and working to protect every single resident of Summit County, and particularly those that are most vulnerable. The room setup that you see is set up to actually promote social distancing. You're not close to each other. You're 6 feet apart from each other, at least. Currently in Ohio, we have 14 confirmed cases of COVID-19. We have another 159 cases being tested across the state. Because of how quickly this situation is changing and how difficult it is to keep up, we do not receive currently specific numbers to our county. There are systems in place that we start to find out who those individuals are, but currently we are doing everything we can once we are notified to start with contact tracing and identify those individuals and assess their risk. We have actively been working, planning, and coordinating our efforts with residents as well as all of our county folks to try to make sure that we assure all residents understand social distancing and hand washing, basic precautions. The governor's strategies to close schools, to try to really get ahead of this by doing some really difficult, inconvenient strategies, will make a huge difference in how much this disease spreads. If there's anything good in any of this, we have learned from other countries how to avoid that spread and how to avoid that peak and overwhelm our healthcare system. And that's by social distancing, limiting visitors, closing schools, doing any number of strategies that we know work. This is an unprecedented time. We have never, ever faced this before in many of our lives. If you're over 100 years old, you may remember and even know the Spanish flu. But for most of us, we had H1N1, we had MERS, we had SARS. We have never seen in our lifetimes this global spread. You can always find the most up-to-date information on our website. I want to make it very clear, Summit County Public Health does not have the ability to test for COVID-19. If you call our helpline, if you call any of we can help you find out where to go and give you a clear pathway to assess as to whether or not you need tested, but we do not test. We make the commitment to serve you based on information we receive from the Ohio Department of Health and the CDC on an hourly basis. And I have to apologize in that information changes so rapidly. What applies today probably doesn't apply tomorrow because we learn something new about this virus, or we learn about a new strategy that might help us contain it. So often it seems like it's mixed messages, but in reality, we're trying to get the most up-to-date information we can to you. And that's our promise. We will. We will be transparent and as effective as we can be in trying to battle this COVID-19. I want us all to remember, please remember, we're all in this together. Treat your neighbors, treat those that may have been somewhere. We're getting lots of reports of people being stigmatized, not treated well. We want you to know that we're all in this together, and it's going to take every single one of us thinking about everybody else, the elderly, young children, anyone, in order for us to really reduce that curve and really not have as much illness as we possibly could have. Now I'm going to turn it over to Mr. Danny Horgan, Mayor of City of Akron.
Thank you. Thank you, Donna, and thank you for really showing the real leadership on this issue through public health, as we appreciate. I'm going to read a brief statement here. As the threat of COVID-19 continues to develop in Ohio and now in Akron and in Summit County, the city has been taking proactive steps to mobilize our public safety resources and to prepare and protect our employees and our community. Today, in response to this outbreak, I signed an executive order declaring a state of emergency in the city of Akron. This will allow greater latitude for us to be able to take any actions necessary to ensure we support the ongoing statewide and local efforts to reduce the risk of this virus spreading. As an example, and under this order, I've suspended all international and domestic air travel for city employees on city business until June 30th, closed all city community centers beginning Monday, March 16th through Monday, April 6th, in alignment with Governor DeWine's school closure order, and ordered a 30-day moratorium on all water service disconnections to make sure all of our residents can rely on our water service to wash their hands and maintain clean households. And I'm asking all Akron residents to remain calm and united and resilient through this outbreak, and to please heed the advice and warnings of our local and state health officials. And a few ways that you can be really good partners to help fight the spread is practice good hand hygiene. Make a plan for you and your family, and avoid any unnecessary large group gatherings and travel. At this point, if you're not taking this seriously, then you're not paying attention, and you should. It's time to change your daily routine, and yes, it's going to be inconvenient, but it is good for the entire community. Think of those that are at most risk for serious complications from this virus and their families, the small businesses and workers who will lose income or work, or others who must make difficult decisions as a result of this international event. By sharing accurate information, which literally changes, like Donna said, hour by hour, following best practices and reacting swiftly to changing circumstances, we will weather this event as a community. Thank you. And now I'd like to introduce Greta Johnson, Chief of Staff for Summit County Executive Eileen Shapiro.
Good afternoon. My name is Greta Johnson, and I am the Assistant Chief of Staff and Public Information Officer for Summit County Executive Eileen Shapiro. And I understand that our residents are deeply concerned, and I want to assure you that our emergency management agency is ready and stays ready. And I'm joined today by our Emergency Management Director, Tom Smoot. We have a staff of experienced professionals who are working directly with first responders, public health officials, and our hospitals to monitor and manage this ongoing situation. I want to reassure you that in Summit County, trained, educated leaders are directing our response. At this time, community containment is the best policy and not an overreaction. And social distancing is a civic duty for all of us. With the guidance of Ohio EMA, we are activating a virtual emergency operations center, which means that the ongoing operation of our local EMA and first responders will continue. They've been doing the work every day. This arrangement allows us to minimize a physical presence and to maximize our ability to support and coordinate with remote elements, as well as communicating with all of our partners. At this time, the authority of the county executive will be invoked to declare a public health emergency in Summit County. Do not be alarmed. This is initiated as a means to recognize the public health concerns presented by COVID-19 and to serve as a mechanism should additional resources become available. We stand ready to assist our 31 communities as well as our fellow government agencies. We've been in contact with charter elected officials, the directors of county agencies, and continue to be in contact with mayors and township trustees. As of this week, county staff and resources have been made available to assist in the essential function of our March 17th primary election. And I join Governor DeWine in urging all of our registered voters to vote and to take advantage of the early vote center. All of our Election Day polls are open and equipped with sanitizing products. Additionally, on Monday, we will seek council approval for an additional $200,000 to add to our contract with the Akron Canton Regional Food Bank, who is already preparing emergency food boxes for school children, their families, and other vulnerable populations. We will also continue to provide accurate, up-to-date information through Summit County Public Health's website and the county executive's social media. Please, folks, engage in good health practices. Continue to show compassion to those who are struggling. Reassure those who are fearful, and encourage others to become educated on this evolving public health crisis. Summit County is thankful for our frontline health workers, first responders, and especially our Health Commissioner, Donna Skota, and her incredible team. Thank you for all you've done for our community and what you will do in the coming days and weeks. Thank you all.
Okay, we're going to open it up to questions at this time. Speakers, as you come up to the podium to answer the question, if you could please state your name, spell it, and your affiliations as well for the media.
The Virtual Emergency Operations Center, could you elaborate a little bit more about what that is and how it serves the community?
I'm sorry,
The emergency.
The Virtual Emergency Operations Center.
Thomas Smoot, Summit County Emergency Management Agency Director, THOMAS-SMOOT. So based on the guidance that we received today from the state, normally when we're activated, we're all in a very close room. Everyone's pretty close together. So we felt like this was the best way to be able to achieve our same mission, kind of coordinate with our partners and be able to provide the same outcome. So we're utilizing WebUOC and a number of other tools to be able to do that virtually. So thank you.
Next question, please.
Sorry if I came in late. Can you talk a little bit more about the actual case and the person with the confirmed case?
I can tell you the information is it's a Summit County female in her 50s that is hospitalized. That's all we know.
Which hospital?
I'm sorry?
Which hospital?
I don't know. This is happening quickly, and we're getting these confirmations, and as we receive information, we will make it available. Yes, Betty?
Do you know if it's community spread or if this woman had traveled?
My understanding is at this point it is community spread, correct, Marlene? Yeah, it was,
Correct.
yes.
Other questions?
I want to add one thing.
Excellent question.
Oh, there is another question.
Oh, I'm sorry.
If there are people who want to get involved and be part of this, all of us in it together, is there a central organization which is sort of matching needs with people who want to be involved to provide assistance?
We've been in conversation, I think the city of Akron, particularly with United Way, trying to figure out what the needs are and how we can sort of mobilize this group of individuals to help. I mean, we originally started this conversation about food boxes and trying to make sure that children, if they weren't in school, and you may have heard on the press conference where the president was speaking, that they have lifted some of the USDA restrictions on the food, so they will be able to deliver some of those food to children while they're off. It just depends on what fits for each community. We also have concerns for homeless. We have concerns for elderly that are shut-ins. And yes, those plans are being made to kind of mobilize the social service organizations. Yes?
So if there are individuals or a group who would like to be of assistance in providing it, but don't have any particular expertise on their own, they just want the volunteer bodies, who would they contact?
I would say right now, probably the best place would be United Way for the food delivery. as well as with the food bank. They're coordinating all of that.
Can I add something?
Sure.
And I would add, that situation may change by tomorrow afternoon. So there may be more organizations doing the same thing that you're asking. And I would be remiss if we didn't stand up here. And we have leaders of the 3 leading hospital institutions in the city who are on the front lines every day. Thank you for doing all this work and really, I think, adapting on an hourly basis of how you need to change. There are thousands of healthcare workers out there in this community who are really on the front lines with our public safety personnel. And I want to thank them because they are really doing an excellent job, not just in the hospitals, but all across the community. And thank you. Our President Margot Somerville is here from Akron City Council, and Rich Swirsky and Jeff Wilhite, President of Summit County Council. Thank you for the support and all of what you're doing for this community. So I'll let you wrap it up. Thanks.
And just to speak to your point too, check back, on our website, Summit County Public Health, because as we become aware of these things, that's a really good place to get resources for Summit County. I mean, the CDC and ODH also have very good information on COVID-19, but any of that community engagement, community Ignite, those situations, those will be, as soon as we become aware of them, we'll put them on our website so that people can volunteer. Because I know the food bank does have to make, food boxes, so they will need additional volunteers to help with that. Betty, did you have?
Can someone talk about testing and availability of testing? I understand Summit County Health doesn't have it. Can we talk? We've got leaders of the hospitals here, and I know I've asked this already, but can we just have it in one spot? Can you talk about the availability of testing? And people are wondering about drive-up testing.
Oh, sure. Is this thing just here? My name is Brian Hart, H-A-R-T-E. That's Brian with an I. I'm the president of Cleveland Clinic Akron General. As Dr. Mihaljevic has stated, I think over the past day or so, the Cleveland Clinic labs have developed the capability on site at the Cleveland Clinic to do COVID-19 testing. What was your other question, Betty?
Drive-up testing?
Right. So that test is currently only available at the Cleveland Clinic main campus. They do have the test available. They are running tests. That we're still ramping up the capability from the standpoint of how many tests that they're able to do. But we do have that capability now. There are also the hospital systems also have the ability to send out to other locations to get the testing done as well. So I can't speak for my comrades, but I believe that is the current reality for all of us. In terms of drive-up testing, again, I do not believe that anyone has that capability right now. The Cleveland Clinic is working to develop drive-up testing capabilities, which we will have more information, I think, over a very short number of days. Anything you want?
Well, good afternoon. I'm Tom File, chair of the Infectious Disease Division at Summa Health. Last name is F-I-L-E. I'm also president of the Infectious Disease Society of America. So I've been both involved in the issue of testing and protocols and policies, both from our institution locally here at Summa, as well as nationally with our professional society. But Betty, specifically to answer your question, we are now in the process of starting to develop testing within the institution. But that takes some time because you have to get the appropriate devices, the equipment, the platforms, and then you have to do validation. And we're in the process of starting to do that, but by the time we'll probably be ramped up in order to do testing, probably at least 2 weeks. Now, we do plan, once we do have testing available, to do drive-through testing. But again, it's probably not going to be till at least the end of this month.
So, Dr. File, that means that any tests that are being tested right now are being sent to the state?
Well, we have a couple options. I mean, yeah, ODH, and then we would go through the local health department through Donna and her colleagues who have been very helpful. Then there are some commercial labs that are available, and we've actually sent some to some commercial labs this week.
My name is Rob McGregor, MCGREGOR, and I'm the Chief Medical Officer at Akron Children's. Akron Children's likewise has developed the beginning of the capacity to test locally. We are in the process of getting that launched and begin the validation, which, as Dr. Powell just said, will take probably about 2 weeks before we can do anything with that. And I do believe that there may be some other discussions at the Regional Hospital Association of some collaborations that our bosses may have just decided we were doing something together, but I don't know that for a fact.
Betty Lynn.
Sorry. You know, what seems to be a question for a lot of people is they want to get tested. And can somebody talk to the idea of, you know, who's getting tested? You don't have, as far as I understand, you don't have enough tests to test everybody that wants to get tested. So what advice do you have for the public who's worried about whether they have the cold, the flu, or COVID?
Let me try to answer that again, Betty. So the first thing is please don't go to the emergency room just to get tested. Please leave the emergency room for emergencies. And I think I speak on behalf of all of us when I say that please help us take the best possible care of patients with emergencies by respecting that. If you're symptomatic, the best way to do it, at least within the Cleveland Clinic Health System, is to do it virtually. That is probably the fastest and most effective way to get access to a provider who can help evaluate your symptoms and then decide what further testing is appropriate and help arrange for that through the testing capabilities. Do you want to take a shot at that?
Well,
Yeah.
No, I totally agree with Brian. I know there's going to be a lot of worried well out there, but quite honestly, I just want to reinforce the fact that the great majority of people who are infected, if they are, it's a self-limited illness. But the greatest concern, and it has already been mentioned by Donna and the mayor, that is the older patients and the patients who have underlying conditions. So unless you're in that category, I think it's important to understand that minimal symptoms are usually associated with younger, healthy people. So they shouldn't really be so concerned about getting tested. But right now, with our policies and with the capacity we have available, we're only going to be testing people that have symptoms. So not people who do not have symptoms. So we would certainly, and I agree with Brian, we don't want those people to be coming to the emergency room just because they want to be tested, because that would be inappropriate use of the facilities and it's going to overwhelm the system.
Thank you. Thank you. She's
Hi, Lynn Clark. I have a question about what's going to happen regarding childcare for the students who are no longer in school. I understand that the governor has relaxed the rules for how many kids can be in a childcare setting. Isn't that just like waiting out of the classroom? That, you know, they've now shut down all the schools. What's the local community going to do about childcare? To assist the parents who may need to go to work, but also make sure the kids are appropriately cared for?
So our Job and Family Services is providing guidance to local child care facilities. They work through us, have contracts with us, get paid through us in different ways. And so we are just coming off of the governor's speech, so we are working through that. The directives have just been sent to our Summit County JFS, and they will be working with the local child care providers. I think what this is going to take is for employers to look at how they are treating their staff and their employees who have children. At Summit County, we are relaxing our standards on how we allow folks to take sick leave. The requirements put upon them typically are going to be relaxed so that they can utilize their sick leave as well as vacation time. We would ask that other employers do the same thing and to be flexible for these folks who have school-aged children. You know, I think that going back to your question, what can well-intended people do? Be kind to each other. Wash your hands. Follow the direction of the public health officials and the doctors who say practice good social distancing. So that is what we're trying to do. I understand your question that putting kids together in an area isn't ideal or optimal, but I think from what we've all been told, while children are carriers, they carry lower risk of mortality. And so we want to make sure that we're stopping the spread, but we also want to make sure people are able to support their families and their children are also cared for.
good point.
Okay, we're going to go go ahead and wrap up this press briefing at this point. Thank you all for coming, and thank you to all of our panelists for attending today.
Thank you.
Thank you.